Alex Earle here, and it's Hump Day with Dr. Alex Earle. This is time we get to spend with you guys and answer all your plastic surgery questions. That's right, but of course before we do that, I'd like to present some plastic surgery topics, and today it's going to be all about something called AlloCLae. That's right, probably something you've never really heard of before because it's pretty new. It came out this year, but it's something that people have been asking for years and years and years, all right? Because what is it? AlloCLae is off-the-shelf fat. That's right. So here we go. So this is what the box looks like, just so you know what it is. It's called AlloCLae right there. Of course, the future of body contouring. That's right. And this box in particular comes in 25 cc's, which is like the biggest box. And then there's one for 12.5 cc's and 25 cc's. Okay. So what is it? So it's literally off-the-shelf fat. It is fat coming from other people, specifically cadaveric fat. And so what is being done is that the fat is being harvested in a similar fashion like you would harvest other organs, like the liver, kidney, heart, etc. And so the fat is harvested, and then it's going through this very unique process, which is that's the new thing, that's the breakthrough. They're able to process this fat, and when they do that, they're able to remove all of the DNA or nuclear material from it. And that's the key thing, because that makes it so that you can then transfer this fat to other people without there being a reaction. Okay? So that's really the key here, is that there is no DNA material in this fat, and so that way I can transfer it to anyone and there won't be an issue. Okay? And so it is structural fat, so it actually has more structure than your own fat. So as you know, I do a ton of BBLs, I do a ton of fat transfer, and when you compare the AlloCLae to just even your own fat, it has more support, it has more of a structure to it, and that's why you get a little bit more of a bang for your buck in terms of the volume, okay? So say for example, I filled a space with 50 cc's of your own fat, versus 50 cc's of the AlloCLae. The AlloCLae is able to expand that space a little bit better. And not only that, but it retains better as well. As you know, when I ever do fat transfer BBL, I always say that we lose a certain percentage of the fat, which is typically about 30%. But with the AlloCLae, we've seen that we've been able to retain about 90%. About 90% of it seems to be retained at anywhere, at longer term, 3, 6 months, up to a year. Okay, so we're super excited about that. And the cool thing, of course, it comes sterile. But the cool thing about it is that it does not require to be done in the operating room. Okay, it can be done in the clinic setting under local anesthetic. Okay, so it doesn't require general anesthesia. It doesn't require all that pre-op stuff you have to do, like the pre-op labs and everything else, because it could just be done under local, in the clinic setting. It's basically a, lunchtime type procedure where you come in, you come out, it takes about an hour to 2, depending on how much volume we're doing. And you can then just even potentially drive yourself home. You don't need anyone necessarily there with you, because we're not giving you anything in the IV. We're not giving you any general anesthesia. Okay? And then it has pretty much little to no downtime. You're back to work right away. And that's some of the huge advantages of this. Okay? So what is it being used for? So the AlloCLae, which comes in the larger volumes, is being used for areas such as the hip dips. We've had really, really great results with hip dips with this material. It can also be used for buttock volume enhancement as well, or for the breasts. Okay, especially if you need just a little bit more coverage, a little bit more fat over the breast to say, for example, cover an implant that shows rippling. That's a great indication for it as well. Super, super excited about it. A lot of advantages there, but what are the potential downsides? Okay, well, it's not meant to, for example, replace a complete BBL, right? So the most that we can put in is usually typically about 200 cc's or so, especially 200 cc's per side would probably be the most that we could do. So it's meant to just give you, a bit of an enhancement. So if you have, for example, you're a very thin patient, your BMI is 19 or 20, you just want to fill in your hip dips just enough so that they don't dip in, but you have like a nice shape, then that's a great solution for you because you don't have any fat. There's no fat for us to harvest, and so you can use the AlloCLae to fill in those hip dips, and you typically won't need any more than 200 cc's per side. Typically, sometimes even less, sometimes like 100 cc's per side will do it for those very thin patients that have no fat and they want to get rid of their hip dips, okay? In terms of buttock enhancement, again, it's only if you want to add just a little bit more. Maybe you had a prior BBL and you have a little flat spot or a couple areas that you just want to fix, and you don't want to go through like general anesthesia and liposuction and all that all over again. And so there's a way to quickly fix the spot without having to go through all that, and you're back to work, no recovery, no fajas, no massages, and none of the other stuff that you have to deal with when you do liposculpture in a BBL. So that's a huge advantage there, okay? And then like I said, for breasts, especially patients that have had have implants, breast augmentation or breast lift with implants, and you need to smooth out an area because say the skin got thin, like our weight loss patients. You have thin skin, the implant shows a little bit of rippling, you need to, give a little bit of volume to the area to smooth it out. Well, this is a great solution for that. Again, not requiring, liposuction and everything else. And so easy in the clinic, local anesthesia, you're in, you're out, you're back to work, pretty much no downtime there, okay? So again, what is it called? It's called AlloCLae. If you haven't heard about this, it's because there's been nothing like this out there. This is the first time we have off-the-shelf fat in volumes like this that we can treat the hip dips, the buttock, the breast, etc. Okay? So yeah, we're super excited about it. It's available here at Pure Plastic Surgery. So that's the other thing. Not many clinics have this available to them, but we are one of the first ones to use it. We're one of the first ones to have it here in South Florida. And we actually do the most volume of, the most procedures, the most volume of AlloCLae pretty much on the entire East Coast. So we're truly experts in this procedure. So you want to check it out, just let us know, okay? But I'm happy to answer any questions about the AlloCLae or anything else that you may have.
All right, first question. I wonder if we can do the BBL and this too, or would you suggest we do a BBL for the permanent look, then instead of doing a round 2, we do AlloCLae?
Yeah, so I think most ideally that's probably the way to do it. So, say you're still at like a little bit lower in the BMI, but you still have some fat, right? And so we'll do your BBL, we'll do your liposculpture, fat transfer, and then if there's like a specific areas that require just a little bit more volume, well, it's not worth doing a whole round 2 again, right? And going through all that trouble, essentially, of like all the pre-op, the anesthesia, the post-op, the massages, et cetera, et cetera, et cetera. And so instead of going through that whole round 2, now we can fix things and improve things with the AlloCLae, and you're boom, boom, you're in, you're out, you're getting that 90% retention rate, and you're good to go.
So I got a BBL 2 years ago. I noticed my hips are decreasing in volume. Would you suggest that I do the AlloCLae, and how long does it last?
Yeah, so if if you're decreasing in volume and what you need is just pop them out just that little bit once again to get that shape that you had before, I think it is a great solution for that. How long does it last? Well, the good news is that similar to your own fat, once it settles, it should last, basically forever, right? For years and years and years, unless of course you have some big life-changing thing, like all of a sudden you lose a ton of weight or things like that. But as long as you maintain your goals, your diet, your nutrition, it should last for a very long time.
Is AlloCLae only performed while awake?
Yeah, well, no, I mean, if I need to add it at the time of surgery, I can, of course. But the advantage of it is that it doesn't have to be done in surgery under general anesthesia, that it can be done awake in the clinic setting. So, yeah, of course, I can do anything in the OR, right? But the huge advantage here is that it doesn't have to be done in the OR. It can be done in the clinic, under local, like you're in, you're out, good to go.
Okay, so we've had this question now 3 to 4 times about pain levels because they're concerned with people being awake. So what's your experience with pain levels?
That's a great question. Okay, so it is done under local anesthetic and you are completely awake. So the only thing that causes, a little bit of discomfort is the initial kind of injection where you're putting in the lidocaine, the numbing medication, okay? And that you'll feel like a little bit of pressure, a little bit of stinging, but typically it's super well tolerated. And once that area is completely numbed, then you're not going to feel any more sharp pain. You may feel a little bit of movement, a little bit of pressure, but that's it. And so it's super well tolerated. And it's done in a very similar way to how we do the local anesthetic for the AlloCLae device. Some of you, as you might know, the AlloCLae device is what we use to treat cellulite. And that's one of the other great things. You can combine the AlloCLae and the AlloCLae. So say you wanted just like a comprehensive treatment of the buttock and thigh area, right? And so you want to deal with your cellulite, you want to have a little bit of volume enhancement, and say, for example, on top of that, you want to tighten up the skin. Well, now we can combine all of that in a great clinic package under local, not requiring any anesthesia, because we can use the AlloCLae device for the cellulite, the AlloCLae for, say, for example, filling in the hip dips, and we can then also do some Morpheus 8 RF microneedling to help the skin. And so now you're treating each individual aspect of that lower body to help improve and rejuvenate that lower body, and it's all being done under local. And so because you've numbed up the whole area, you can do all three all at once.
Next question. I have a BBL lipo 360 December 2nd.
All right.
But my BMI is 31 instead of 30. Can I still proceed with my surgery with you, Dr. Earle, or would I have to switch?
No, you don't have to switch because you have time, all right? So our procedure's in December, we're now towards the end of July, so you have time to drop those, whatever it is, 5 pounds or so. So just do your very, very best, okay? Do your best to see if you can get down to that 30. It shouldn't be too much more that you have to go through. I know that you can do it, and I'm sure that by the time you get here on December 2nd, it's gonna be very close to 30, not 30, and we're gonna be good to go.
How can I know if I can get just lipo or if I need a tummy tuck?
So that's a great question, and that's going to depend on 2 important factors. Number 1 is the skin, especially the skin in the belly area. So do you have loose skin? If the answer is no, then typically we go to liposuction. If the answer is yes, then you have to ask how loose. Is it mild to moderate? Then sometimes you can do liposuction with Vaser and J plasma, and that's going to be enough because the Vaser and J plasma is going to help tighten up that skin. However, if it's like moderate plus to severe, then you're going to need that tummy tuck. And then the second question is, how are your muscles? Are your muscles nice and strong and together, or are they separated and weak? Okay? If you have muscles that are separated and weak, then we should do a tummy tuck so we can strengthen that muscle layer. Remember, liposuction does nothing for your muscles.
Can you sculpt the waist and lower back area to define the buttocks without getting a BBL?
So yeah, in the right candidate, you can actually do that. So when you shrink the waist and all the fat kind of just above the buttock and all around that area, it does create the illusion of a larger buttocks. So a lot of times you can do it if that's within your goals, of course. Now, if you tell me like, hey, I want significantly wider hips and significantly more projection, well, in that case, then it's better to do the fat transfer as well.
Thank you. Do you do plus size tummy tucks?
Well, my max BMI is 30, so if you're plus size to a max BMI of 30, then yes. But I don't do any patients above that BMI.
Do you recommend getting lipo 360, a tummy tuck, and BBL at the same time?
So I do not, okay? I do not recommend combining those procedures. I think if you need all of those procedures, my recommendation is to do the tummy tuck first, and then come back 3 months later and do your liposculpture and BBL, okay? Why is that? Because I feel that when you combine all those procedures, your complication or potential for complications goes way up, right? And my number 1 priority here at Pure Plastic Surgery is your safety and trying to keep complication rates as low as possible. What are the possible complications that go up? Certainly potential for bleeding and then ending up in the hospital needing blood transfusions. The complications rate for infection goes up. And importantly, because this can be super serious, the complication rate for blood clots, whether in the legs or the lungs, goes significantly higher, and that can be very dangerous. It can land you in the hospital or potentially even death. Okay, so for all those reasons, I do not recommend combining all those procedures at once. I rather stage them.
With a breast lift, do you lipo the armpit area?
If you need it, we can. It would be considered an add-on, but yeah, certainly we can do it at the time of the breast lift to give you a better contour of the entire area.
I'm getting Vaser with my lipo BBL. Does that basically tighten my back and stomach?
Yeah, so I love the Vaser, and we use it all in the entire trunk. So yes, we're gonna use it in your belly, we're gonna use it in your flanks, your sides, your back, and so what it does is that it basically emulsifies the fat or knocks off the fat from the surrounding tissue. It also has energy to it, so I'm able to remove more fat with less bleeding, less inflammation, and better skin retraction. I mean, it's a beautiful device. I mean, who doesn't want all that?
What kind of work will I mostly need if I have diastasis recti?
Yeah, so that was if you guys refer to the previous question about lipo versus tummy tuck. So diastasis recti means that the muscles are separated, and so if the muscles are separated, then you need a tummy tuck.
All right. Can I get ab etching along with my breast lift?
Definitely, all right? We like to call it a Miami makeover. That's what we call it here at Pure. But yeah, you can combine, say like what we call liposculpture 180 with high definition, so HD lipo 180, where we can do all your ab etching. We can even etch out some of the other muscles in the belly, and we can do a breast procedure at that time. And it's whatever breast procedure you need, right? Whether it's a breast lift, breast reduction, breast aug, breast lift with implants, whatever it is.
Let's see here. For the AlloCLae?
Yes.
Can this basically replace BBL?
So yeah, so that's the one caveat, right? So I said, pretty much probably the max that we're able to use right now is about 200 cc's per side. So it's not really meant to like fully replace a BBL, especially if you do have some fat on you, okay? But it can certainly be used in and of itself for hip dips. So like I said, you're a lower BMI patient, you have hip dips, you don't have a lot of fat to work with, that is a great solution for you.
I just had a tummy tuck with skin removal. I'm 3 weeks post-op. How long does it take to walk straight?
Oh yeah. I mean, you should be getting pretty close. I mean, for most of my patients, they're walking straight somewhere between week 2 and week 3. So if you're not fully walking straight just yet, I think it's going to be pretty close. Shouldn't be too much longer now.
I quit vaping nicotine and on a no nicotine vape.
Great.
Have you heard of patients testing positive for nicotine with the zero nicotine vapes?
Unfortunately, I have, because you really have to read the fine print. Some of the quote unquote no nicotine vapes actually have a very small amount of nicotine in them. So just be careful. Just make sure that the one that you're getting actually has 0.00 nicotine in it.
All right, well, this is a good segue for the next question. Marijuana prior to surgery. Is it okay to smoke marijuana?
Yeah, so we're okay with that. We're okay with pretty much any form of THC. So whether it's smoking, edibles, etc. THC is okay. You're going to be able to proceed with surgery.
Do you do breast aug with fat transfer to the breasts?
So I personally don't, but we have 2 other surgeons here at Pure Plastic Surgery, Dr. Vidal, Dr. Weger, and they do. So they do, liposuction, liposculpture with fat transfer to the breast for augmentation purposes. So if you're interested in that, then yeah, certainly let us know, and we can hook you up with Dr. Vidal, Dr. Weger for that.
Is it possible to get AlloCLae fat transfer to the breast?
And you can do that as well, as long, again, as you're looking for like a moderate, modest increase in the breast size, right? You're not looking for something like hugely or vastly different. Then yes, you can use some AlloCLae to improve the volume of the breast. But once again, we're not talking about, like huge differences here. We're using for more like enhanced natural results.
Thank you. Let's see. Okay, question about Avelli. What is the difference between Avelli and AlloCLae?
So they're 2 completely different things, right? So the AlloCLae is, like I said here, it's the off-the-shelf fat, and that's what we use to increase volume. And so the Avelli device, what it is, it's like it's almost like you can think of it like a little rod with a little knife at the end, because what that does is that it cuts bands that are causing cellulite. So cellulite is caused by these bands that pull down on the skin because the bands attach the skin to the underlying muscle and therefore it pulls the skin down, and that creates that dimple, which is the appearance of the cellulite. So if you go in with this device and you cut all those bands, then that skin is released, and then that will smooth out the area, and then that gets rid of the cellulite.
Thank you. Let's see if I can say this. I take Earle 24 every day, which is birth control.
Okay.
Is it safe to just stop taking it a month before surgery when I've been on it for years? I'm nervous about that.
Yeah, so it is safe to do it. Of course, I always recommend you want to double check with your either primary care doctor or your OB-GYN doctor, okay, your GYN. But it should be safe to do that, to stop it. And typically we do ask you to stop it from 30 days before surgery to 30 days after.
How long will it take for me to walk after a BBL lipo?
So I want you walking almost right away, okay? Walking is actually very, very important. You want to do that in order to decrease or minimize the risk of blood clots in the legs, called DVTs, deep vein thrombosis. And so you want to be walking, you can walk even like the same day, all right? But certainly by the next day, you should be up and walking at least 10 minutes every hour while awake.
If someone who has a square shape, can they achieve hourglass figure with just lipo?
So what I've seen most of the time is that if you have a very square shape and you want that hourglass shape, most patients are going to require some degree of fat transfer, okay? So I think BBL is actually a better solution for that, so that you can, you have the freedom as a surgeon to be able to enhance certain areas. So when I decrease the waist, I can just enhance the hips, and we don't have to go crazy, we don't have to go too wide, but just to create that nice hourglass shape, it's better to be able to do so with some fat transfer. So I think BBL is typically the better procedure for that.
Can people with scoliosis surgery get lipo 360, BBL, and or tummy tucks? I have the Harrington rods attached to my spine.
Yes. So as long as, of course, this happened a while ago, you're fully healed, everything's going well, and we have clearance from your doctors, then typically, yes, it is okay to have either lipo or tummy tuck after that procedure.
Okay, a few more questions before you go.
All right.
Can fat necrosis be removed?
It can be removed. So now the question is, should we remove it, right? And that's going to depend on a couple factors. Number one, is it symptomatic? Is it causing you issues, right? Such as pain, okay? And number two is how big is it? How much of it is there, okay? If you have little small areas of fat necrosis that are not really bothering you, they're just there, then a lot of times it's best to just kind of leave it alone. If it's a large area and it's causing you pain and other issues, then yes, in that case we can go back and remove the fat necrosis.
Can I get AlloCLae to my butt during my tummy tuck?
Yeah, I mean theoretically you can. Like I said, say this would be very typical. Say a patient that maybe had a BBL before. And they want to enhance just a few specific certain areas, like they want to, maybe they got a flat spot because they lost fat in a certain spot. So that particular patient, we can go in, we can do the AlloCLae, fix the area, make it better, give you a little bit more volume, and then go ahead and proceed and do the tummy tuck.
What breast implants do you recommend for someone who is looking to go from an A cup to a D cup without looking like they have two basketballs under their skin?
No, that's a great question, all right? So, and to be honest, it's very patient dependent because it depends on your frame, your underlying foundation, your skin and your measurements, all right? But, just kind of in general terms, typically you can go from an A cup to a D cup, but, if you want to have a more kind of natural look, usually what you're going to want to use is what's called a moderate profile implant. So the higher the profile, the more, fake it looks, if you will. So there's moderate, high, and ultra high. So ultra high is the most fake looking. Moderate is the more natural looking one. So we'll go typically for like a larger, moderate profile implant, and that will give you, a D cup with a more natural look.
All right, let's see. Last question.
All right.
I want to get a BBL done, but I know you do natural look. I want it to be larger than natural.
All right, yeah, so that's great. So can it be done? In theory, yes, definitely we can do that. And I do try to, of course, tailor my surgeries to the patient's wants, right? And of course their expectations. But there may always be some, limitations in terms of your anatomy. And really what becomes the biggest rate limiting step typically in that situation is just how far the skin will stretch, right? So say you want to have a lot of projection, right? You want to look more than natural. And I have to then be able to stretch that skin to reach there. But sometimes the skin, will get to a point where it just can't physically stretch anymore. And so once I get to that point, it's basically your body telling me like, hey, Dr. Earle, this is as far as we can go today. All right? And so the short answer is yes, we can try to do that, but there are going to be some limitations given your anatomy, especially your skin, and just how far it will stretch for us.
Thank you very much.
All right. Okay, everybody. It was a little bit short and sweet today, but I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. All right. I'll see you then. Take care.